Hello and welcome to this expert panel taking stock on global health as part of foreign policy by Canadians. Thanks so much for joining us today. We're very excited about this panel. My name is Julia Anderson and I'm the CEO of CanWaCH, the Canadian Partnership for Women and Children's Health, one of the partners as part of the Foreign Policy by Canadians project. I'm joining you today from the traditional territory of the Mississauga Anishinaabe people, commonly known on settler maps as Peterborough. Pay respect to the Mississauga and the Anishinaabe people, who are the traditional guardians of the land. I've had the great privilege of working and learning from many elders in this community, and I hope that my remarks today do honor to those teachings and reflect much of the learning that I've taken. On behalf of the Canadian International Council, or CIC, Global Canada, and as at the Canadian Partnership for Women and Children's Health, I'm very pleased to welcome you today. I hope that it will be an insightful and dynamic panel discussion as we take stock on global health, a subject matter that is on many minds as it relates to COVID-19. So COVID-19 has had a devastating impact, not just in Canada, but certainly around the world. Millions continue to struggle and face the secondary effects, or what have in some cases become the first effects of an economic collapse, poverty, malnutrition, etc. The pandemic has highlighted how interconnected the world is as Canada and countries across the globe grapple with issues such as climate change, varying sort of access to basic services such as WASH, water, sanitation, and hygiene, and fragile health systems that are often inaccessible. So we know that where it was once thought as the great equalizer, it is now known as the great revealer, that is revealing the inequalities that existed before and are now made more potent in this current climate. Canada has worked, I think many of our members, our partners have worked to address the global public health issues and the economic challenges. But the question really that we are offering this panel and are trying to explore through this series is, can these efforts be maintained? Can a balance between responding to COVID or one infectious disease versus all the other global health challenges that face us be found? So how are we balancing those things? How are we engaging, and how are we choosing to intervene around the world? To unpack these issues and to provide avenues to build back better, or build forward better, as many say, I'm joined by four public health experts who are going to speak today. I've asked them to not be incredibly coordinated in their approach, rather to bring their distinct perspectives to the table. And hopefully through those distinct perspectives, we can start to draw some narratives out. Our first speaker today will be Dr. Jennifer Blake. She is the Chief Executive Officer of the Society of Obstetricians and Gynecologists of Canada, SOGC. She's going to highlight the centrality and critical role of primary health systems in not only addressing COVID-19, but in realizing a safer, more secure world. And she's also going to speak briefly on the power of investing in long-term partnerships. She'll be followed by Dr. Samuel Oti, who is the Senior Program Specialist for Global Health at the International Development Research Center. He's going to build on the power of investing in strong and consistent relationships with strategic partners to enable the IDRC and others to be more agile in responding to the evidence that is needed during this pandemic. It's a huge challenge bringing evidence to bear on policy decisions, and he'll speak to that. Then Dr. Nilima Gulrajani, who is a PhD Senior Research Fellow with ODI, or the Overseas Development Institute, will share her recent research on Canada's investments toward a global response to COVID-19 and how those investments compare to other donors. She's been working hard to track in a very quickly moving and fast-paced environment who's doing what and what kind of impact we foresee that having. We're going to close up with Dr. Tim Evans, who's the director of the School of Population and Global Health at McGill University, and one of the 5 leaders in Canada's COVID-19 Immunity Task Force. And he's going to speak to the linkages between Canada's domestic health policy challenges and our global response. And certainly I've been in conversation with many of the speakers about the ways in which as we shift to look inwards and bring expert opinion to bear on what's happening with Canada, what's the impact then on conversations about our foreign policy and how global health factors into that foreign policy. So I'm very excited to hear from all of these speakers. I would ask the panelists to just go through one by one your presentations. So we'll move from Dr. Blake to Dr. Odie to Dr. Gulrajani to Dr. Evans. So you can move through your questions. And then we have a few questions that we can sort of bounce around. I would also encourage you as panelists to ask each other questions. CanWaCH has explored many different formats for webinars, and sometimes your questions to one another can be really insightful because you've been sitting and thinking about these things. And participants, you're welcome to put your questions in the Q&A boxes, and if we have time, we'll come to those as well. Today, throughout the day, you'll have an opportunity to engage, but also we want to make sure that we had the opinions and insights from as many diverse expert panelists as we could. So with that, I will pass the floor over to you, Dr. Blake. Thank you so much for being here. The floor is yours.
Thank you, Julia. And let me start out by saying that I would never call myself an expert in public health, although I thank you for this suggestion. I am an obstetrician gynecologist. The SOGC has been involved in sexual reproductive health pursuits for women around the globe for well over 20 years. And I've had the opportunity of sitting on the board of CanMNCH, now CanWaCH, which has been a great privilege. And so was very happy to speak today to the centrality of primary healthcare systems, particularly as they involve women. And we come back to that real difficulty of how do we extricate reproductive, maternal, and newborn child health from overall development goals. They are central to being able to achieve development, but they are so interdependent. And I was never happier when the Sustainable Development Goals were announced and the acknowledgement of how complex and how interconnected all of these, that we can see them as silos, but they aren't. They are totally enmeshed and interdependent. When we add on to this COVID, we start to see a number of other challenges, and many have spoken to and written about the particular challenges that would come to countries where the parts of the population may be immune suppressed because of chronic illness or nutrition. The challenges for any state, never mind states that have to struggle with lower resources to mount the necessary for infrastructure, for personal protective gear, for testing, for keeping the healthcare system safe. But there are some very specific issues that then impact women. What we know from our experience in Canada is that women who are in unsafe home situations, domestic situations, have been particularly challenged during lockdown. And we have seen an increase in sexual violence, and we believe that this is probably true around the world for women in those circumstances. Access to care is compromised with COVID, and this affects not just the emergent care that people need, but it's also the preventive care, which becomes particularly important around family planning and pregnancy care. In obstetrics, we have particular issues that impact women who are infected with COVID while pregnant, and particularly in the last third of pregnancy, when the pregnant uterus is now pressing up against the lungs, we've seen real risks to mothers at that point, increased need for ICU support, and much greater challenges providing the care for women. But there's some other issues that people may not be thinking about, and that is that women, by and large, make up the backbone of our healthcare providers, and they are at increased risk because they're exposed to COVID and to patients with COVID. And so illness amongst healthcare providers is a risk. If those healthcare providers are also women of reproductive age, that amplifies the risk of not just losing healthcare providers to COVID, but also a particularly vulnerable group. And then, of course, that creates a systemic risk. And we're seeing this play out in parts of Canada as you begin to lose the necessary cadre of healthcare providers that you need for your care. And it all comes back down to that question about the centrality of reproductive, maternal, newborn, child health to the overall health of a country. And if you think of our own experience in Canada, we watched maternal mortality decline in the 50s and 60s. No one thought that we had a problem with maternal mortality at that time. And the declines were not because there were huge advances in medicine. At that time, there really weren't. But we did have social advances, access to contraception, access to education and higher education, access to full employment, the overall status of women. All of these issues had a huge impact on a hard outcome such as maternal mortality. And if we think about it more broadly, we now understand that a healthy pregnancy actually leads to shaping the health potential of that baby as an adult. And that's not just their overall health. We know about obesity, we know about diabetes, we also know about cognitive potential. So investing back in pregnancy in a healthy mother, a well-nourished mother who receives good care and has a healthy delivery becomes a fundamental if you want to have a population that can achieve its potential. This knowledge then got further amplified as we began to understand about epigenetics. Most of us grew up thinking about genetics as being the DNA that you inherit that gives you blue eyes or brown eyes, black hair or blonde hair. But what we now understand is it's not just what you inherit from your parents, it's actually what you're exposed to as a developing fetus that can modify your genetic code, can modify your health potential, and will be passed on by you to your progeny. So what we are exposed to when pregnant becomes an even more critical factor in the overall health of the population. And we know that good nutrition, social stability, these things actually can mitigate the harms that we would otherwise be exposed to in pregnancy. Contrary-wise, undernutrition, social stressors actually can create epigenetic changes. So there is no more pressing central need than to ensure that we give every child that's born that potential healthy start. And that means we can't just look at prenatal care and facility-based care. We have to look at education and nutrition and primary health care. And that again becomes more stressed during COVID because women don't have access to the primary healthcare supports. Those resources have often been deployed. What we saw during the Ebola pandemic was maternal mortality rates went up. They went up because women weren't receiving care. They went up because women were afraid to go into facilities for their deliveries. And they went up because resources were elsewhere. So remaining vigilant that we don't compromise the primary healthcare systems that have been set up with great investments and great difficulty over the past decades. We can't neglect the infections, and I think we've had our eye on TB, malaria, HIV, but what we hear from gynecologists across Africa is that they are saving women from maternal mortality only to watch them die from cervical cancer. The ability to screen and treat cervical cancer is simply not there in most countries, and yet we can prevent it with a simple vaccine. All of these things become important because healthy families are the basis of a stable and secure society. So amongst our SDGs, we have put security, but we can't achieve security unless we start at the basics, and the basics are that healthy family. And my final plea is, as we think about our role in development, one of the most heartbreaking things that we see is the short-termism in so much international development, that we go into a country with a grant that gives us 3 or 5 years of funding to do a particular project. It takes that country, the country that we've partnered with has to divert resources to focus on that project. They have to deliver the project. They have to measure the things that our funders want us to measure. And then they wind it down with all of their reporting and are left with nothing to follow up with. And I have been to too many places and seen too many badges and certificates on the wall from a succession of funders. And I really hope that Canada decides that our role will be as a long-term sustainable partner so that we don't engage in this short-termism. I think that's enough, Julia.
Excellent, thank you. Over to you, Dr. Oti.
All right, just waiting for my slides. And hello, everyone. Thank you for having me on this panel. So I'll be talking about my organization, the International Development Research Center, and how we've tried to respond rapidly to opportunities for supporting evidence generation on COVID in the Global South. So next slide, please. So a little bit about us. We are a Canadian Crown Corporation established by an Act of Parliament in 1970. So it's our 50th year of doing this. And basically we focus on, funding research in the Global South and building capacity of global Southern leaders, research leaders to sort of develop their own research agendas and implement their own research priorities. And so basically it's all about building capacity and building Southern leadership for research and innovation in the Global South. Next slide. We have our head office in Ottawa, and we have 5 regional offices, one in Montevideo, Dakar, Amman, New Delhi, and I sit in the Nairobi office, which is our office, regional office for Eastern and Southern Africa. Next slide, please. We have a forthcoming strategy, and just circling back to what Dr. Blake said about short-termism. In the past, we've had 5-year strategies, and recognizing that 5 years is a short time in the field of development. For the first time, we are having a longer-term strategy, and it's going to be a 10-year strategy, which I think is still not long enough. But realistically, it's a strategy I think that will give us better opportunity to have impact on the ground. And we have 5 program divisions, new programming divisions, that will be sort of supporting reaching our goals through this strategy. And that's around global health, education and science, democratic and inclusive governance, climate resilient food systems, and sustainable and inclusive economies. Next slide, please. So why did we need to respond, or why did we see the need to respond to COVID in the Global South? Obviously, we've heard this a million times, unprecedented times. It's a virus that knows no borders, so we all need to collaborate. And typically we're as vulnerable as the weakest link. And so we need global collaboration to defeat this virus, and science and research and innovation are vital for us to be able to find solutions and ensure that no one is left behind, particularly in the Global South, where capacities and resources might be very constrained. And so we are all about supporting local capacities in order to generate knowledge and innovation that will meet the local needs in the different local contexts of the Global South. Next slide. So how are we doing this? And so what we're doing is that we're working to identify the knowledge gaps, but most importantly, we are responding to the pandemic through what we're calling innovative initiatives. And I'll tell you a little bit why I feel they're innovative. But the pandemic has really forced us to think about the way we work and to be more agile in responding to the research needs. But we're not only thinking about health needs, we're also thinking about the broader economic and social impacts of the pandemic. So even the rapid response initiatives that we are trying to implement and that we are implementing is also not just addressing health issues, but trying to look at the broader social and economic issues in the Global South as well. Next slide, please. So generally, I think what has really helped us to be agile and nimble in this context is to leverage the strong relationships that we have with Canadian institutions, with international partners, and obviously with the long-standing relationships we have with think tanks, academic institutions, research institutions in the Global South. So being able to activate the stronger relationships has helped us to be agile and to be responsive. But we also remain committed, understanding that these are very constraining times, these are uncertain times. So we're really trying to support our grantees and our research partners to continue working and adapting even in the face of the constraints that they have. And even internally, in terms of our programming, we've had to adapt our business processes so that we can issue grants more efficiently and faster under the circumstances. Next slide, please. So in terms of health, what are we doing? We are, like I said, collaborating with Canadian international partners. We are looking to help researchers in the Global South to develop, test, and study various interventions towards COVID. And hopefully, in the long run, we are hoping to build the capacities of the Global South to respond and to be more responsive to this pandemic and to the pandemic, and to also prepare them for potentially for future pandemics. All right. Next slide, please. And so these are some of the initiatives that we've been able to launch in the past couple of months. And one brings together quite a number of Canadian institutions, from the Canadian Institutes of Health Research all the way to Alberta Innovates. And it's a relatively large amount of money, 160 million Canadian, and we've contributed about 8.5 million of this to sort of respond to the need to generate evidence around COVID-19. And I'll give a couple of examples of some of the research that we funded through this initiative. Next slide. We also have a COVID-19 Africa Rapid Grant Fund, and this is working through the science granting councils in Africa. And health is not the only issue that they're addressing, but we're working with the South African National Research Fund, the UK Research Institute, and a couple of other funders to support science granting councils to also support local research in the different contexts in the Global South. We have another partnership with the Swedish International Development Agency around artificial intelligence and COVID. And we have our own initiative on the health of refugees and vulnerable populations. And this is important to ensure that we leave no one behind in the true sense of the word. And so we're investing around $6 million on research in refugees and on vulnerable populations. Next slide, please. So this is just one of the examples, and this is looking at managing the impact of COVID-19 in the refugee camp, and this is in Bangladesh. And again, this was a grant that we were able to issue in the last couple of months, being led by a Canadian institution in partnership with Southern researchers. Next slide. Another example, developing integrated guidelines for healthcare workers. This has been very important because there's been a lot of confusion, especially in the early days, as to how frontline health workers would respond to COVID. Where are the standards? Where are the clinical guidelines? And so this is a project that we funded to sort of develop this integrated guidelines. And this is focusing on Sri Lanka. Next slide, please. But like I said, we're not just thinking about health. We have about 25 million that's going into social and economic response projects. We have a partnership with the Global Partnership for Education, 2.5 million. That is going to help developing countries to keep learning, and so that's focused on education. And then we have a couple of grants as well on food and nutrition security in the context of COVID-19. Next slide, and I think that should be the last one. So I think in summary for us, it's all been about our strong partnerships, our strategic partners, and not just in Canada, but internationally, and being able to leverage these partnerships and to respond rapidly to the opportunities that we've seen. At the same time, we've not lost sight of other priorities, such as the Feminist International Assistance Policy. So gender programming framework continues to develop and continues to evolve and guides our programming, and as well as our internal processes. And in the long run, again, circling back to what Dr. Bleak said about short-termism, our aim or intention is to help low and middle-income countries to respond rapidly to this pandemic, to prepare them for future pandemics, so that in the long run, they'll be, sort of reduce their need for international assistance. So thank you very much, and sorry I had to go pretty quickly to try to keep the time.
Excellent, thank you. And Nilima, I will pass it on to you.
Thanks very much, Julia, and thank you to all for the invitation to speak on this panel with such esteemed health experts. Like many of you, I was shocked by how quickly the world seemed to be descending into anarchy in mid-March of this year, whether that be in my grocery store, in the fight for baking flour, or in the hijacking of planes ready to take off with ventilators and N95 to a nation that had just slipped in with a higher bid. I asked myself many times whether I was witnessing the end of solidarity, whether that be in a grocery aisle or in global international relations, or really whether this offered the possibility of a new beginning underpinned by our shared vulnerabilities to a virulent pathogen with no known cure. As a researcher of aid organizations and trends based at the Overseas Development Institute, I would like to put this conversation on global health into a wider context of donors operating in a competitive foreign policy climate where traditional norms of aid giving are under strain. And so what I'd like to do as quickly as I possibly can in 8 minutes is give you a sense of how Canada is performing both as a traditional bilateral donor that must balance its own global values against its own interests, and as a donor dealing with an unprecedented global shock that goes well beyond health. So to use the term of Richard Horton of The Lancet, not a pandemic, but a syndemic, a crisis that underlines the social origins and impact of disease. To do this, I want to draw on a major report that's being launched today by the Overseas Development Institute titled Principled Aid in Divided Times, and later I can put a link on in the chat. And my main argument is that there's an opportunity in this crisis that Canada should not let go to waste. The crisis offers Canada a time to transform itself into a bold and ambitious bilateral donor that practices what it preaches. And it also offers a time to transform the world at large by working with allies to build development resilience, while also reducing its own vulnerabilities to the global challenges that we will increasingly face. And so I want to structure this in 3 parts. First part is really trying to identify where Canada is now, how it's doing as a donor leading up to the crisis, and then within it. Where do we want Canada to be? What should its vision and objectives be, given the coronavirus has upended the aims and modus operandi of development assistance? And then how does Canada get there? What kinds of leadership, financing, and modalities will be required to achieve that ambition that we set for ourselves? So in terms of where are we now, the ODI's Principled Aid Index is being launched today, as I mentioned. It's a 3-dimensional measure of the balance that the 29 rich world donors strike between pursuing their values and their long-term interests in global security, stability, and prosperity. We proxy donor motives by looking at their foreign aid allocations. And the last year we have data for is 2018. And today I'm really pleased to announce that Canada ranks 4th globally on this index. Where does it do well? It does well in investing in global cooperation and plugging critical development gaps. A high share of its ODA going towards infectious diseases is a notable high. It has a high share of its ODA, or overseas development assistance, dedicated to assisting conflict-affected states and funding social safety nets in financially challenged countries. Where it could do better is in terms of allocating aid to maximize development impact, avoiding allocations that advance narrow short-term commercial or geopolitical interests. For example, aid is not always targeting local actors and channels in the most efficient manner. So far, so good. Canada seems to be decently balancing its values and interests in its aid allocation, even as its aid budget continues to be below the DAC average of 0.3% ODA GNI. In terms of its coronavirus response, so if you can compare coronavirus to a plane trying to make a crash landing, I think it's fair to say that Canada, like most other donors, has been largely putting oxygen masks on its own citizens first. Its overseas assistance as a share of its domestic fiscal response sits at less than 0.5% of its overall COVID fiscal response. That puts it in 12th place amongst DAC members, including behind a Trump government of the United States. If you look at the quality of its global multilateral health investments, Canada has displayed a strong preference for standalone vertical disease global health funds in the past, Gavi Global Fund. In terms of COVID, 92% of its multilateral COVID response has targeted the ACT accelerator, which is the main global mechanism on COVID, but it is a mechanism focused on virus treatment, containment, and eradication, where you could argue that Canada, like many other rich world donors, stand to benefit directly. Canada's investment in global COVID-19 funds is equivalent to more than 10% of its total 2019 ODA spend. And there is a very high likelihood that this spending will displace ODA spending in other important areas. And investments in these global funds dwarfs investments in country-based pool funds, even though the latter are thought to be more responsive to local needs and actors. We also see, in terms of its COVID response, a limited support for global public health agencies like the WHO. Canada seems to be doing the bare minimum in terms of financing through assessed contributions, which are really its membership dues. Whereas 80% of the WHO's $5.6 billion operating budget comes from voluntary contributions. Canada provided no voluntary contributions in 2019 and in the first 2 quarters of 2020, even voluntary contributions that are highly earmarked and thus easily controlled by Canada and steered by Canada. And one could argue that the efficacy of the WHO is undermined by its lack of predictable funding by its member states to allow it to fulfill its mandate. And then just lastly, in terms of where we are, vaccine nationalism. So there's been a report in the Globe and Mail recently. Canada has invested in 7 vaccine doses per citizen in 6 deals as it hedges its bet on a potential vaccine. That's the most bets placed of any country in the world. And its contributions to the COVAX AMC, which is meant to pool resources to enable low-income countries to access vaccines for 20% of its population, while generous, are dwarfed by commitments of other donors like the UK, for example, that has only invested in vaccines for itself to the tune of 2.7 doses per citizen. So a summary of where we are: Canada steered a course that's broadly balanced its values on global solidarity and its principled interests, and has done this even as the size of its ODA continues to remain modest. However, its global health response to coronavirus seems to have steered a more deliberate focus on protecting Canadian citizens, primarily by funding global virus containment, vaccine development. And that is an understandable response. We see it amongst most donors, but I think now is the time to really transition our COVID response, to really think about putting oxygen masks on other passengers in this plane. And so where I think we need to go, briefly in a few minutes, I think we do need to think about how we can transition our immediate crisis response reflexes into engagement in a protracted effort to build development resilience overseas, thus addressing the social determinants of ill health that have been made much more clear through COVID, that are complex, intractable, and perhaps offer a less direct link to Canada's short-term national interests in quickly eliminating the virus. Arguably, the crisis is an opportunity to reimagine what a donor looking to address existential global challenges should be doing in practice. Part of this transition will require Canada transforming some of its foundational narratives, its bureaucratic cultures, and the partners and modalities it chooses. On the other hand, there's also scope to build upon its feminist donor identity to champion a recovery and address the structural impediments to equality and fairness that are the source of ill health. I think I have 1 minute or 2 minutes maybe, but I just want to quickly outline some critical leadership pathways that Canada might like to think about. So the first is, I think we need boldness and ambition. I think our culture, our bureaucratic culture, has tended to be somewhat risk averse. And I think there are many reasons for this. But I think the exercise that CanWaCH, Global Canada, and CIC are engaged with now to engage and energize Canadians behind a vision is really one way to push the frontiers of ambition forward, to show that citizens are demanding a new normal, a foreign policy that advances principled Canadian engagements, that recognizes our shared interest in a stable, secure, and sustainable world. So we need this vision to be compelling, bold, and actionable, and we need to reject magic bullet solutions and seek to deliver quick wins within an electoral cycle. Going back to Dr. Blake's point about the short term being 3 to 5 years, in the donor world, that's actually long term. And I think we really need to try and figure out how we can create the incentives for these long-term partnerships and long bets and real risk taking. We need to work with allies, including on the role and function of multilateralism. And Canada can work with like-minded donors, partners like Ireland, the Scandinavians, Francophone countries like Switzerland and Luxembourg that all do equally as well on the Principled Aid Index. But it can't only work with those who share its worldviews. It needs to use its seat in the G20 to advocate for a global effort uniting the world's most powerful countries to address these structural impediments to poverty and ill health. And lastly, we need to practice what we preach. We need to show countries that Canada refuses to instrumentalize its aid for narrow-minded gains, whether that be by selling arms to countries acting as parties to a conflict that Canada is also trying to diffuse through its aid response, as in the case of Yemen and Saudi Arabia, or informally tying our aid to Canadian NGOs, instead working directly with organizations in the South. If Canada believes in multilateralism, it needs to fund the system properly. Its core support for international organizations is falling. Project-based earmarking is growing. We seem to be adopting an a la carte, pick a mix approach to multilateralism. We need to be more strategic. And so just to conclude, the UN Secretary General in his Nelson Mandela annual lecture this year said, COVID-19 is exposing fallacies and falsehoods everywhere, including the myth that we are all in the same boat. Because while we are all floating on the same sea, it's clear that some of us are in super yachts, while others are clinging to the floating debris. Canada needs to recognize it's on a super yacht when placed in global perspective, notwithstanding the internal inequalities that continue to plague it. And I think this crisis is an opportunity to ensure others at least have a Canadian coup to ride the wave at minimum. It may also require us to downgrade in our own vessel, our own super yacht, to level the playing field somewhat. We need to show the world that principled nationalism is not an oxymoron, but at the core of Canadian foreign and development policy. And against a backdrop of shared global vulnerability, it's really the only way, principled nationalism is the only way we can all obtain the baking flour we all need to create a cake that we all need to eat. Thanks.
Thank you, Nilima. And Dr. Evans, Tim, I turn it over to you.
Thank you very much. And please remind me never to follow Dr. Gulrajani again. That was a brilliant presentation, and thanks too to Dr. Odie and Dr. Blake. I'll try and complement what's been said in the last across these presentations by focusing on this. I think on the imperative for foreign policy to have much greater convergence with our most important domestic challenges, and the prism of the current pandemic is perhaps one that is overused in the current context, but if you look at the extent to which it's changed all of our lives for everyone, everywhere on this earth, it's hard to overstress just how important this is. The striking paradox in this pandemic is that the richest countries have been hit hardest. And if you had paid attention to WHO's measures of pandemic preparedness under something called the Joint External Evaluation or Johns Hopkins Global Health Security Index, Canada was apparently prepared. And so too was the US. And so too were many of the countries of Europe. And I think I really think that this is part of the humbling reality with respect to the nature of the challenges we're facing globally, and not only in the context of health, but also climate change and other even behavioral issues related to erosive populism and intolerance with respect to and distrust of collective institutions that are responsible for our well-being. So I think the first thing I'd like to say is that our foreign policy has to move away from especially in the context of development, from some sense of charity and noblesse oblige, to one which recognizes that it's about our collective future. It's not us and them, it's all of us together. We have shared vulnerability as a planet, and if we don't embrace that across all of our policy, we're probably blind on many fronts. So let me pursue this in the context of the pandemic in Canada. We got hit hard by SARS in 2003, and we created the Public Health Agency of Canada as our savior. This was the institutional piece that was missing. If we secured a strong functioning Public Health Agency of Canada, we would be in good shape. Now, with no disrespect to the Public Health Agency of Canada, if you look at our performance around key parameters with respect to this pandemic in terms of what you would expect from the public response, there's no doubt that there's room for improvement. Let me focus on one area in particular. Testing. We had committed to testing 200,000 Canadians a day, and we're somewhere around 60,000, despite being in the midst of the second wave now. We had tons of time. There were lots of clarions and suggestions to scale up testing going back to March of this year. And what we've seen is actually testing systems had sputtered and stalled. And now we're hoping that antigen tests that will be rapid will save the day, without understanding why surge and speed as primary determinants of performance in the context of emergency have been so elusive. And so we have a lot of learning at home that is a function of questioning whether the structures that we have are fit for purpose and what we need to do to make them more fit for purpose. And it relates to a shared problem. This problem of getting testing systems up to speed and scale is one that has plagued not just Canada, the United States, and many other countries. However, from a comparative basis, if you look at what has happened, say in Korea or Thailand or Singapore, you see testing systems, or Uruguay, for example, testing systems that have been scaled, that are real time, that have surged, that have aligned laboratories, whether they're in the public, private, or academic sector, and have managed innovative ways of testing with resource constraints, which are doing a good job. So it's not as if it's impossible. And in context of foreign policy, we have an imperative to understand how we can learn more effectively from that positive deviance, rather than to assume somehow our problems are contextually so specific that we really have nothing to learn from the global reality. Another area is to look and see at the extent to which Canada's pandemic has followed the trajectory of systemic inequalities that are so often found across health systems. And Jenny, you mentioned the importance of epigenetics, but we see this disproportionate clustering in vulnerable groups. Our performance with respect to long-term care is nothing short of a national disaster. 80% of deaths in this pandemic have taken care in long-term care facilities. These have been isolated parts of the health system. They have no accountability. There's no good monitoring systems that understand conditions within these facilities. And very concerningly, in the context of the generation of information that we need to do better, long-term care facilities are systematically excluded. They don't fit into our research infrastructure for clinical trials, which has people going to hospitals. So we're not taking trials to the epicenter of deaths in the pandemic in Canada. We're avoiding those. We're not counting them. And as a result, as we see in Manitoba, as early as yesterday, or as late as yesterday, we see a continued pattern of disproportionate impact in these so-called long-term care homes. It's not limited to the elderly or the frail elderly. We've seen infection risk absolutely cluster in racialized minority populations in this country. And you see it in Toronto, you see it in Montreal. This is an absolute crisis, which again, research and understanding has been way too slow to address. So these are things, again, that are really part of our domestic challenge, but ones that are seen not only in Canada, and therefore in this convergence that I'm suggesting, our understanding and our innovation and our ingenuity need to embrace and understand the global commons in terms of how we can do better. Let me shift to a third point then, which is beyond understanding our shortfalls in the context of the global situation, but also addresses the opportunity moving forward. And I was delighted that Nilima spoke about this pandemic as a syndemic. And what I'd like to say is that we're on the cusp of a very exciting time in which we can not only think and understand about pandemics and syndemics as being part of the challenge that we have to face globally, but also the omics. These are the genomics, the proteomics, the metabolomics, the microbiomics, the environomics. And we're in a very exciting era where these different sources of data can now come together, intersectionality and pooled, so that we have that multi-level, transdisciplinary, transsectoral, and transnational understanding of common problems. And I think this is an area where increasingly our common survival faced with these common threats is going to be contingent. How do we mobilize this knowledge more systematically so that we understand these dynamics and identify entry points which are going to perhaps make our interventions more nuanced and more understanding of the complexity that we're trying to deal with. So let me finish by saying that I feel the primary thrust of our foreign policy needs to be about harnessing collective ingenuity to face these critical challenges that are upon us with respect to the welfare and well-being of our planet. And the sooner that we can generate a policy that is embracing of that and finance it in such a way that it's less one institution versus another and more about what you can mobilize around collective problems, then I think we're going to move into an era where problem solving and progress on problem solving is much more the metric of progress versus relative sums of money going in one direction or the other. Thanks.
Thank you very much. A rich discussion from all four of you. I heard this kind of situation of what we know and what we know to be true and the answers that we have. Jenny, you outlined at the beginning, we know, in fact, that investments in primary healthcare, in education, nutrition, et cetera, we know the impact that these will have and that they will lower the incidence and impact of COVID, right? And we see that throughout, that innovation, in fact, is sometimes not what's needed, but doing what we know to be effective is what's needed. And then we heard throughout the need for innovation and finally, posited this idea of foreign policy, I think, not only as an external and what we do in other countries and what we engage with, but in fact, the information and knowledge that can be garnered and gained through our foreign policy, what the learnings that we can draw through that, and sort of how that all stacks up against other donors, but not just other donors, just other countries. So how can we take what's happening in Uruguay, for example, and quickly apply and take that evidence and turn it into domestic policy and then share it back out internationally again. All very interesting. I promised to open it up to the panel to ask questions of one another. So I'm watching your mute buttons. Please feel free to go off of mute and ask questions of one another. But just quickly, we do have a couple of questions from the floor that I think we can get to, at least two of them. One, I think you spoke to, so maybe if one person can kind of take it on and elaborate. Perhaps Dr. Blake, the weakening and denigrating of multilateral institutions like the World Health Organization did not help in dealing with the challenge, this problem, I'm assuming meaning COVID, on a global scale. Would you agree? Certainly I heard that throughout the presentations, but maybe an elaboration of that.
Well, I think you've picked the person who's probably in the weakest position to answer this from a position of knowledge, but from a position of passion, absolutely. And as Tim has pointed out, as Nilima has pointed out, as Dr. Otis pointed out, we are all so interconnected, and viruses, microbes do not carry passports, that we need to be thinking about these challenges collectively. I really did like that notion of balancing our national interest against a principle-based aid. Well, there is no better way to be able to balance out all of those than when we all have to put our national interests a little bit in our back pocket. But anything that we do that improves the global's ability to respond to a pandemic is in our national interest. And so 100% we need multilateral institutions like the World Health Organization. And we need to mobilize everyone's best energy, best innovation, and solutions, because we're all working through problems that we're just encountering for the first time.
Excellent. And the next question is a very specific. So I'm wondering if Tim, if you can speak to this, but feel free to pass it on. The creation of by Canada of the Global Health Public Information Network came in the wake of SARS and was offered to the World Health Organization, who welcomed this major contribution to its monitoring capacity. but it seems that this capability was allowed to run down just before COVID-19 struck. Can you speak to why you see this as happening and what can be done to revive or renew this global monitoring asset? I don't know if you know anything about, I'm assuming you do, but I'll pass it to you.
Yes, yeah, I do know a little bit about it. And it's very interesting because one of the challenges of maintaining tools and assets for pandemics is this very nasty sort of policy cycle of panic and neglect, which characterizes responses to emergencies. So everything's important during the pandemic, but once it's over, everybody says, whew, now we don't have to worry about things anymore. And so this is something that I observed at WHO, which is maintaining and sustaining the capacity for preparedness and vigilance and things like the GFIN, Global Public Health Information Network, were not things that WHO could take on its own, in part because of the way it was financed, as Nilima identified. It's been chronically underfinanced since going back to the 1980s. And secondly, it was also something that seemed to slip through the cracks at the Public Health Agency of Canada. And again, a recognition that an agency with multiple expectations, trying to manage things on many fronts, sometimes doesn't pay attention to maintaining assets in a way that they're up and ready when crisis strikes, which is always unpredictable. So I would view this as on both fronts is an underinvestment in core public health functions. And I think the lack of understanding of the need to keep those vital, so that in the context of the crisis, they're ready to provide early detection information, which was where GFIN's greatest strength was and is, I would believe. But also in the context of the crisis, that these information systems can surge. And so it's not just that you have them at baseline, but they can grow to become more effective in real time. And this is something that neither WHO nor PHAC or all of our provincial public health institutions have done particularly well. And the irony in Canada is the two worst, the provinces with the most resources and most people have been the least able to get their testing systems in shape, Ontario and Quebec. Contrast to the Atlantic provinces, they've done a pretty good job and are doing a good job. And I'd say some of the provinces in the West are doing well, have done reasonably well, although there's real pressure on those systems at the moment.
To pick up on Dr. Gulrajani's analogy, this is the perspective from the yacht, but the yacht can still have engine trouble. And when it does, we have to go and assess and understand where that's coming from, and certainly, think about the broader sea and who else is out there and what kind of, if this is what it looks like from the Canadian perspective, a wealthy nation, a G7 nation. Really, I think it's incredibly important to think about what it looks like elsewhere, which I think this panel has given great insight into. There is a tremendous amount to do and to undertake. And I think simplification, clarity, and understanding what small steps can be taken, but also where surges are needed. That word has been used in multiple places. So where do we need to surge? Where do we need to engage big in order to see this pandemic and its secondary effects minimized and ended for good is the question. I thank you each for your contributions. And I I hope you'll jump on to our next session with Minister Gould and the rest of the sessions throughout the day. So thank you everyone for joining us. Goodbye.